Hey y'all, I told you I was gonna come back with another taping, and I have my friend Marissa online. We FaceTiming. And y'all, I got everything rigged up, all ghetto. Marissa's actually in Chicago, and we met each other through online. Um Marissa, you suffered two losses just like I suffered two losses.
Correct.
Yeah, and your last loss was with Angel this past March.
March 21st. Yeah,
Yes.
19 weeks, 3 days.
19.
And my first loss was last year, August 3rd, with my boy at 20 weeks.
And when you were pregnant after with your first baby, did they ever diagnose you with an incompetent cervix?
No, they did not. They diagnosed it as preterm labor and put me on the P17 injections and did like a wait and see approach.
That was with
the cervical
Darian.
length.
That was with your first baby with Darian, or was that with Angel?
No, it wasn't with Damari. It was with Angel.
I'm sorry, Damari. Yeah. Okay. So you had your first loss with Damari, and that was in September of
August.
I don't know.
Last year.
We're so close apart because, I lost Melody in September, so it was in August. And then with Angel, what they did was they put you on the P17 and they did the wait and see approach. And but they never told you that you had an incompetent cervix even when you was pregnant with Angel.
They did, no.
Okay, but they went ahead with the P17. And so bottom line, everything started happening all over again. It was a whole nightmare. I understand. Because my second one, I lost Harmony last April. And so when you lost her, did they then say you had an incompetent cervix when you lost Angel in March?
Well, the hospital that I delivered at was in no way affiliated with the clinic that I was receiving my prenatal care at.
Mm-hmm.
And they did say that, it had to be IC. And I was also looking up the TAC, and I found Dr. Hanny, and, he's right here in Chicago.
Right.
So from there, I emailed him, which you know about. And he there told me there was no other way that those things could have happened to me besides an incompetent cervix.
Right. Mm-hmm.
And when I returned from my 6-week checkup, she still
didn't
tried
believe
to say that it wasn't an incompetent cervix.
And
I was speaking with Dr. Hanny yesterday when he came to talk to me before I left the hospital. He just said she's just naive. She tried to say that maybe my uterus was shaped abnormal, and Dr. Hanny's like, no, everything in there looked fine except the cervix.
And I think you also explained to me too that you asked her about the TAC, and she tried to say she didn't know it, or was just, what did she say when you asked her?
At that point, I had my surgery date scheduled. So when I went to my checkup, I said I was going to play a role with her, and I was like, is there anything else we can do besides the cerclage if things go wrong with the next pregnancy? She was like, no, that'll just, you got to get someone just to put it on really tight. And I'm like, what about something I was Googling? I believe it's called a Transabdominal Cerclage. And she was like, oh, yeah, that doesn't work because if you miscarry, the tissues won't come out, which I already knew that was false because I had spoke with Dr. Handy for over an hour about it, and I had did a lot of research on it.
But you were trying to see, right? But you were trying to see if she knew something, or if she was going
to recommend it, right?
But more so,
definitely did.
Right? But more so, it was that she was trying to deter you from even getting that, and so you went ahead and you just went ahead and scheduled your transabdominal cerclage, which I'm super happy with Dr. Handy. I always say Handy. But what made you go ahead and just say, you know what, I'm just going to go ahead and get this TAC done?
Well, like Dr. Handy even stated plenty of times, at the hospital, like he stated, without this TAC, the same thing will continuously happen.
Yeah.
And I feel like it is painful. I am in pain right now, but it does not at all compare to the pain I felt losing my baby.
So it in a way, it brings you may not be able to get your babies back, but at least you can go after what caused their death. So it gives you a tiny bit of closure, and you can finally say, I can go forward now and try to have more children. So
Right.
there are a lot of women now that are going to be getting a Dr. Handy TAC, a Dr. Davis, or Summers, or whatever new doctor that's out there that's doing a transabdominal cerclage. And they have two different things. I got mine laparoscopically robotic, and you got yours traditional, which is the C-section. And you just had yours done, what was it, the day before yesterday,
Friday.
17th? Right,
Yeah.
the 17th. So, we want to see what the scar look like.
Okay, so let me kind of put my sheet over because I'm bottomless. And they also still have the tape on it. I can't remove the surgical tape
It's
for
cool.
10 days.
I want to see, like, okay. See, that's not that big at all. How long do you have to keep the tape on there? And is it dissolved or is it staples? What is it?
I have the dissolvable stitches, and the tape stays on for 10 days. He said I can wet it. I wet it when I got in the shower. It's actually coming up a little bit, as you can see.
Mm-hmm.
But I wet it and I washed it, and he told me it might even start to fall off.
Okay.
Before I have to peel it off.
Okay, and on a scale 1 through 10, how did the pain feel when you came out of surgery? Because I know, y'all, just to let you know too, me and Marissa, we talk on the phone like every day. So, you know, she FaceTimed me and she like look at my lip, look what
Yeah, swole still.
It was the bust your lip or something. And you, girl, you just look like you was so drugged up, like, I said, girl, you look like you got hit by a truck. But I was so excited that you got that TAC done. But on a scale 1 through 10, how does it, how does it feel, like, far as pain wise?
Okay, so I had the morphine, but getting out of surgery, I was still in the twilight zone. But I remember them putting the thing in my hand and telling me, "You feel pain? Press this button." So I was clicking away. It's like just like a pen, just click it.
And so you were able to. So you were administrating the drugs, and you by pen by.
Yeah.
Oh. Yeah, I know you was going trigger happy.
Yeah. So from there,
But you really couldn't feel.
I remember though.
Could you feel the pain, or every time you felt like a niche coming back?
Yeah, every time I felt a little nip, I just clicked the button. So I didn't really feel too much pain until yesterday when they took the button away from me, and I was like, "No more medicine." And he was like, "No, now you got to take your rope." So yeah, they took the catheter out at 4 a.m. and took the button away at the same time. So, and even with the catheter actually caused more pain because they had it they had some kind of tape thing on my leg, and they had the cord to the catheter going in a loop, so the urine wasn't going straight down. Mm-hmm, it was going back up to the bladder.
Oh, okay.
And I called them I feel like I'm peeing, but then again, I don't know if it's coming out. So once they fixed that, it was better. But the pain then, I remember them asking, and I kept saying 6. The pain was around 6. Mm-hmm. Now, being home, the pain is gotten worse because I have to move more on my own.
And you said climb in, and your bed is a little higher too. So that kind of,
Climb in and out of bed is a task. Getting to the restroom is a task. I'm walking bent over.
And you gotta, just to let y'all know too, she has a pre-pregnancy, so she's not pregnant yet.
No,
she has a pre-pregnancy transabdominal cerclage. And what did she say? Dr. Hannity said to your mother that your daughter has good genitals. What you say?
She has gorgeous genitals. And I was like, huh? And when he came in the room, he was like, "You have," I said, "Yeah, I heard." He was like, "Your fallopian tubes, your uterus, everything is just beautiful. Maybe I'm used to seeing them all over the place, but they're so beautiful." And I'm like, "Okay, doctor."
That's what's up.
He was really nice.
All right. Okay, that's a great compliment. Because, he is one of the top doctors that I've heard that he does over 200 transabdominal cerclages a year. And women fly all over. And I've never met the guy. I've seen his face before, but I've heard wonderful things about him. So how long are they saying that your recovery is going to take? Well, what are they projecting, ballpark figure-wise?
Well, the main thing, it's no restrictions. The main thing he's saying is driving. 10 days of driving.
You can't drive.
He said he wants me to have someone take me on a test drive in my car before I drive again. He wants me to go to a parking lot and make sure I can do like the main functions of driving, back in, back out, and park.
Mm-hmm.
But other than that, it's like he's encouraging me to move, which I don't think I'm gonna do for about maybe a week.
So what is your main issue right now? I've heard of constipation. I heard of gas.
Mm-hmm.
Like, are your top shoulders hurting right here?
I'm sorry?
Are your top shoulders hurting, like right here?
No, the shoulder's not hurting. But I can tell you something I noticed before I even called. When I get up out the bed, it's like I'm taking shallow breaths. They gave me this thing here.
Mm-hmm.
And she got the arrow where she wanted. And she wants me to
breathe in. Okay. Oh, I see. Y'all fancy. I didn't get all that. So I wonder if
she wants me to do it 10 times each hour, because with the breathing tube, it's like I have a lot of mucus in my chest. When I cough, you can hear it, but it hurts like hell to cough. So when I cough, you can hear like the cold in my chest, and it's like to prevent getting pneumonia. She wants me to do this and try to cough the mucus up, which I've got a little of it up, but like I said, it hurts to cough, it hurts to laugh, and I have the pillow pressed against, because I can't really look up transabdominal cerclages the traditional way and see how people deal with it, but something close to it is C-section. So I've been looking up C-sections, how to deal with C-sections. And like people saying, keep a pillow held closely to it when you cough or sneeze, and those things are working because it's the same incision.
And like you said, it hurts too, even if you laugh or something like that. So I can imagine. Yeah. Now, as far as gas wise and like trying to have a BM, a bowel movement, gas access, and you got, girl, I see the extra strength on there too.
Yeah, girl, no, the constipation. I finally had a bowel movement.
Good.
Maybe about an hour ago.
Okay, good.
I hadn't had a bowel movement since the morning of my surgery. Before I left. I finally had a bowel movement. I've been taking stool softeners like heck, and it finally worked. I took 2 this morning. I found the threshold.
Good.
The gas X, on the other hand, I have been passing gas, but not as, I feel like it's way more in me than what's coming out.
Right. And so I was asking you too, that where do you, of course you're going to have some pain down there, but because with me, I guess I had a laparoscopically that it didn't hurt me. Like I said, the next day I was mowing the lawn and stuff. But you said between your belly button on down, it kind of hurts. That's where you feel your pain more.
So basically,
around the incision, basically where he did the incision at.
On this whole area, it's paining like this whole area right here.
Okay. Are you having any swelling?
No swelling. Because
some women say they have swelling. Okay, just
it's a little bloated.
Okay.
But no swelling.
Okay, and so I know the number one question that a lot of women ask Dr. Haney is, when can you try for a baby? So what did he tell you?
Dr. Haney told me right away. Wow. And, usually he cracks a joke with, wait till you get to the parking lot. Over the phone, he had told me 12 hours. But yesterday, sternly, with a stern face, he actually said, whenever you feel like you're ready, just go ahead. It's in now. It's working. It could be used. My pain, the way I'm feeling, I don't want to intercourse for a while. But if you can tolerate this pain with an intercourse, then go right ahead. But he encouraged you to go right ahead and try.
And did you ask him? He told
me when I do have a baby, he don't want a picture of my baby because they all look the same. He said he just wants to see a family picture.
Yes. That's awesome. I know that was like music to your ears for him to just be like, go ahead. Because I'm going to tell you something. When Dr. Davis followed up and called me, I said, Dr. Davis, is there anything you need? He said, nope, just have a baby. And that made me feel so empowering, because I really thought that was it for me. And so when do you think you're going to be trying for babies? When do you think you're going to put that TAC to use, girl?
within the next few months, I think I'll be trying.
Yeah, okay. I'm gonna get that phone call, girl. You know I'm pregnant.
You might, but just going off estimate, I think maybe within the next few months I'll be, emotionally ready.
Yeah, you're right. You're right. Physically. And I could totally understand that because with Harmony, that one knocked me down to my core that I was really afraid. But you know what? Actually, when I got my TAC, I want to say about 2 months after that, I was ready to put it to the test. But you do have to get your mental together because even with a transabdominal cerclage, you're still like on edge of what if. And I think most women, what we are afraid of with the TAC is, what if the water breaks or something like that. And you don't want to think that, but after what we went through, these are the things that we think about now. So what would you say to all of the other ladies that are thinking about getting a transabdominal cerclage, and some of them may be afraid, like the biggest decision was, if I get this surgery done, it's going to permanently hinder me from ever having a baby vaginally, a natural birth. Me personally, I said after what I went through, after what I lost, I didn't care. So, but it was a decision that you have to make because, some women can go in and get the TAC removed, but who's going to really pay more money just to get it removed too, unless you just got money sitting in the bank like that? So, what would you say to other women that are thinking about getting a transabdominal cerclage, but they may be afraid about getting it done?
I'll tell them to go for it because, like I said, there's no pain worse than the pain that you experience losing your child.
Yeah.
And this here it's a physical pain. And with losing your child, you felt pain physically and emotionally.
Yeah.
This is something that you can get over with just, moving around and getting your muscles back intact and
popping pills.
Popping pills. But that other pain was something you couldn't get rid of. Right. And if your insurance cover it or if you can afford it, just go for it.
Right. And we know too that the success rate with a transabdominal cerclage is very high. And I don't know if it was you who told me, it was a couple of women too that said that Dr. Hannity was talking to, I think he mentioned something about the transvaginals that sooner or later they're going to kind of do away with that.
Yeah, that was me. Yeah, he said in the next 5 years he don't even see transvaginal cerclage even existing anymore. And I have 2 bands, so.
He did. I didn't even ask you that. He put you 2 bands. I told you, girl, ask him if he's gonna put 2 bands on you.
The nurse said that he gives pregnant women 1 band and pre-pregnant women 2 bands.
Oh, really? You know what? Well, I don't know about that because my friend Zakia, she has 2 bands on her, and she went to Dr. Hanny. She was pregnant. She was 9 weeks when she got it. But he gave her 2 bands. A lot of pregnant women on elbow loopers, I believe, have 2 bands too. Yeah, but anyway, look, more the merrier. Because when I asked Dr. Davis, I said more the merrier. Because when I asked Dr. Davis, I was like, "Can I get 2 bands?" Because I heard Dr. Hanny was giving 2 bands. Dr. Davis just laughed at me like, "No." But that's what's up, 2 bands.
Yeah, and he said the way things look, because he said my cervix isn't short. He said my cervix is nice and long. It's something in the inside, like the support inside the cervix, is what I'm missing. So he said that's what's going on in mine. It's not that mine is too short.
It's the support.
That's not what it is. It's the support or some kind of wall in the cervix. I can't remember the name he gave it, but. Or I need to cough. But that's what he said it was.
You want to know that hurt.
Girl, those coughs.
Coughs, laughs, gas, getting out the bed. Oh my gosh. And I got 9 days until Symphony is going to be here. And I'm like, oh my gosh. I'm looking I'm like, bring it on. But,
girl, you're going to be carrying that baby up here.
Look, the way you texted me last night was like, this stuff hurts. Oh my gosh, I can't imagine it with a baby.
I was hurting bad last night.
Huh?
I said I was hurting bad last night. I popped that Percocet and went right to sleep. And got up in the middle of the night and took some more.
And what positions do you sleep? Like, do you sleep on your side, your back, or?
I'm usually a stomach sleeper. And the hospital on my back's killing me. So I've been getting on my left side. I've been sleeping on my left side. I've been napping throughout the day on my left side. I tried my right, and I don't know. Felt like I was pulling the skin around the incision. So I flipped back over to my left side.
And you was telling me too, because y'all can't see, but Marissa got tattoos down there. But you said that he kind of put a line through the heart.
He cut through my star.
Okay, through the star. Okay.
And I told him, I said, now with a C-section, I know this cut not gonna be this small. And he told me they got to go up a little more. He said, I guess they just gonna follow the dotted line.
You can't even really see. You just like, where is it? Where is it? And I asked you to, because I know your mom was there. And like I was telling you, when I met her in Baltimore, to me, it felt like it took like 30 minutes, no later than 40 minutes for them to be done with the surgery. How long did your mom say she was waiting and that your surgery took?
She said it was about an hour, 20 minutes. And after the surgery, they took me somewhere for 2 hours. And I guess I slept. All I remember is waking up in a room that I got dressed in. And it was like, transportation, okay, you ready to go? And I just remember being pushed down the hall, and he was like, okay, another bump. Okay, we're going to hit another bump. I remember getting on the elevator. He's like, okay, we're going to hit a small bump. I just remember him telling me what the bumps were. And by that time, we was up at another room, and it was like, okay, now you need to get over to the other bed. So, and I remember switching beds.
Okay. Now, tell me this, too, because, you know, when I had got my TAC, I told you the nurse was hot, and I knew she had those drugs. I knew she had them in that needle, and I said to myself, I'm going to stay awake. I'm going to try to see if I can fight this. But next thing I know, I woke up, and she was like, you did good. So what was the last thing you remember before they put you under?
They gave me, you know, when you go to McDonald's or something, you get the coffee cream on the side, the little cup. She had me drink something, so it was like a really strong, bitter taste. It was for acid reflux. She had me take a shot of that.
Really?
And as strolling me down the hall, I saw her with a needle in her hand. I saw her push something down, and I don't know what she did. I just remember getting in the room, and she had an oxygen mask. She's like, okay, you need to take in a lot of oxygen, Marissa. You need a lot of oxygen in your body. She's like, take in oxygen. Come on, Marissa, take in more oxygen. And I remember trying to tell her she didn't have the mask all the way on. It was like this much off to where the air was coming out.
Okay.
But she kept telling me I wasn't taking in enough. And I just remember trying to tell her that. And I don't know what happened next. I was up.
Now, I remember when you had the, when you FaceTime, you had the little oxygen in your nostrils and stuff. Was that in your nostrils when she gave you the mask? Or when you woke up, you just saw it there?
When I woke up, that was there.
That was there,
my busted lip.
Yeah, I had one too. And I'm going to tell you something. I don't know what that's from. Maybe they had to stick something down in your throat, but I woke up
and my breathing tube down my throat. Yeah. That's what the whole mucus thing is about. But I don't know why my lip ended up busted.
I said the same thing too. I was like, was somebody rough? I mean, what was y'all doing? Beating me up while I was sleeping? But yeah, so oh yeah. And also too, I remember before you went into your surgery, I think this was like maybe a week or a couple of days before then, that they sent you, Gina's the person that schedules everything, but they sent you those wipes, and you had to wipe. Was it just your belly area that you had to wipe, or you had to wipe your whole entire area?
No, it's 3 packets of wipes, and each packet has 2 wipes. The first night, the night before, with the first wipe, I did my chest and my arms. And with the first wipe I did my chest, the second wipe I did my arms. Then I opened up the other pack. I did my stomach, and then I did my right leg and my left leg. And the next morning, with the first wipe, I did my chest and my stomach. And the second wipe, I did my legs.
So you said how many?
And they'll have it on the paper what you're supposed to do each night.
Okay, and how many wipes was it again?
It was 3 packets of 2, so it was 6 wipes.
Okay, and they must be some antibiotic type of thing just to make sure.
And it's a sticker on the front of wipes. You're supposed to stick on the paper and sign your signature. They didn't even take my paper. So I still have the paper. I don't know why nobody took it.
Okay, and I know a lot of women too, because your story is so strong, and a lot of women can relate to that, because I had one lady that just posted that she just lost her son last Friday. And so I'm sure they're going to be looking forward to maybe if you start doing blogs or vlogs and talking about your journey, because I think it's really important that we all really talk about incompetent cervix and what we went through when we've dealt with these losses. One thing I noticed, Angel really, really hit me hard, because at one point in time, me and you, we were just emailing back and forth because we were both due around the same time. And
yeah, for that part.
Yeah, and for it not to, for her, for you to lose Angel in March, all because of the wait and see approach, and that more women need to be, we need to really speak up and not allow these doctors to say we're just going to wait and see, because there are great doctors out here like Dr. Haney, Dr. Davis, and so many other doctors that can say, hey, this is what's going on, and we prefer you to get this, that, and the third. So, I'm hoping that later on, Marissa, that you will start vlogging and blogging and giving these ladies the update, because and you're young too. You're like in your early 20s. So this doesn't just happen to women like me in my late 30s, or women as hitting their 40s or whatever like that. This happens to different ages of women. So I really hope that you do start doing vlogs and really speaking out against an incompetent cervix, and I'm really looking forward to seeing your journey. I already said I think you're gonna have at least like 4 kids. You're gonna have 4 kids, girl. You got plenty of time. You're gonna have a whole bunch of kids. So, but I'm super excited. So when you called, when I saw you, I was like, oh, you a TAC sister now. So I think it's awesome. How do you feel? Do you feel like the weight is lifted off? Do you feel empowered? Like you can do anything? Good.
I feel like I can't believe I did it.
Yeah.
I mean, because do you remember I was just waiting on my phone consultation?
Yes.
In April, when I was like, I had to reschedule it, and now here I am recovering.
Yes. And I didn't realize the wait was just so crazy. Just to get a consultation in is something.
Yeah.
But you've got it.
I said when the 4th of July came, I was going to have 2.5 weeks left.
Mm-hmm.
It came, this came.
Right, and it's like, you got it. I'm super, super duper excited. Well, what I'm going to do, Marissa, is I'm going to give you a call. But everybody, this is Marissa, and
nice to meet you, ladies. And you definitely will be hearing from me. I'm gonna get my channel.
Yes.
And start my vlog soon.
Yes. And so we're gonna say y'all ta-ta for now. And Marissa, I'm about to call you on the phone, girl. I'm about to upload this now. All right.
Okay. Bye-bye.
Bye.